Hey everyone, welcome back, and thank you for taking a few minutes to be here today, because what I want to talk about in this video is extremely important for anyone who is currently on Medicare or will be on Medicare at any point during 2026. There are some very big changes coming, and quite honestly, some of these changes are going to catch a lot of beneficiaries completely off guard. That is exactly why I wanted to put this video together, break everything down in plain English, and walk you through what is actually changing, why it matters, and how it could directly affect your coverage, your access to care, and even how much money comes out of your pocket this year. I have an article right here that outlines 11 major changes to Medicare in 2026, and in just a moment, I'm going to pop it up on the screen so you can see it for yourself and read along if you'd like. I always encourage you to look at the source material directly so you know this isn't speculation, rumors, or fear-based headlines. These are real policy changes that are already happening or officially rolling out this year. Now, I'm not going to go line by line through all 11 changes in this video, simply because that would take an extremely long time. Instead, I want to focus on the 4 or 5 changes that are by far the most impactful and the ones that are going to affect the largest number of Medicare beneficiaries in a very big way. One thing I want to make very clear right from the start is this: Medicare is not a set it and forget it program. A lot of people assume that once they enroll, everything just stays the same year after year, and that could not be further from the truth. Medicare is a hands-on program. It changes constantly. Premiums change, deductibles change, networks change, drug formularies change, and rules change. With nearly 70 million people currently enrolled in Medicare, even small changes can have massive ripple effects. When you start talking about changes this significant, it means millions of people are going to feel the impact, whether they're prepared for it or not. That's one of the main reasons I wanted to bring this information directly to you. Over the years, I've seen far too many people blindsided by changes they didn't know were coming. They assume their doctor will always be in network. They assume their medication will always be covered. They assume their costs will stay about the same. And then one day they get a bill or a denial or a notice in the mail, and suddenly everything changes. My goal here is to help you avoid that kind of surprise. Before we dive into the changes themselves, I want to quickly mention something important. If at any point during 2026 you have questions about Medicare, whether you're already enrolled, getting ready to enroll for the first time, or trying to figure out which plan actually makes sense for your personal situation, there is free help available. I've partnered with a Medicare assistance service that helps people review their coverage, enroll properly, and find plans that actually fit their needs. There is no cost to you at all for this help. Over the past year alone, thousands of people in this community have reached out, and collectively, they've saved about $2 million just by getting a proper review of their Medicare coverage. That's real money back into people's pockets, simply by asking questions and getting guidance. If you ever feel confused or unsure, please take advantage of free resources like that. There's absolutely no reason to struggle through this alone. Now let's get into the article and start talking about what's actually changing in 2026. The first major change I want to talk about is the Medicare Part B premium. I know this one sounds basic, and I know it's something we talk about every year, but it still manages to surprise people over and over again. For 2026, the standard Medicare Part B premium has increased to $22.90 per month. That might not sound like much at first glance, but when you look at the percentage increase, it's significant. This represents nearly a 10% increase compared to last year. In 2025, the premium was $17.90, and now it's jumped to $22.90. That is a noticeable increase, especially for people living on a fixed income. When you're budgeting every dollar, even a few extra dollars a month can make a difference. And remember, Part B premiums are typically deducted directly from your Social Security check. That means if your Social Security benefit doesn't increase by more than the premium increase, you could actually see less money in your pocket each month. What makes this even more frustrating for a lot of people is that premium increases often feel disconnected from improvements in care. People ask, why am I paying more but still dealing with the same limitations, networks, and delays? It's a fair question, and unfortunately, it's one that doesn't always have a satisfying answer. The reality is that healthcare costs continue to rise, and Medicare premiums tend to follow that upward trend. The next major change is one that I cannot stress enough, because this is one of the biggest ways people get caught off guard every single year. Provider networks are changing, and they are changing in a big way. Doctors, clinics, hospitals, and entire healthcare systems go in and out of Medicare plan networks far more often than people realize. Just because your doctor was in network last year does not mean they will still be in network this year. This is especially important for anyone enrolled in a Medicare Advantage plan. These plans rely heavily on networks, and when a provider leaves the network, you may suddenly find yourself unable to see the doctor you've been seeing for years. Imagine going to schedule an appointment and being told, "We no longer accept your plan." For many people, that's not just an inconvenience. It can disrupt ongoing treatment, delay care, and force you to start over with a new provider who doesn't know your medical history. What's even more concerning is that some entire hospital systems have started pulling back from Medicare participation altogether. That means it's not just one doctor or one office leaving the network, but entire hospitals no longer accepting certain Medicare plans. If you have a preferred hospital or a specialist you rely on, you absolutely must double-check that they are still in network for 2026. This is not something you want to find out during a medical emergency. Another massive change coming in 2026 involves prior authorizations, and this one is generating a lot of concern among beneficiaries and healthcare providers alike. 6 states are rolling out a new AI-based prior authorization system for Medicare. These states are Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Under this new system, artificial intelligence will be used to evaluate and approve or deny certain medical services for Medicare beneficiaries. This pilot program applies to 17 different medical conditions. That means if you live in one of these 6 states and you need treatment for one of those conditions, a computer system may be the one deciding whether your care is approved. That alone raises serious questions about accuracy, fairness, and transparency. Healthcare decisions are complex, and many people are understandably uncomfortable with the idea of an algorithm making decisions that directly affect their health. What makes this especially important to pay attention to is the fact that this is just a pilot program. If it's deemed successful, there's a very real possibility it could be expanded nationwide. That would mean more states, more conditions, and more situations where AI plays a role in determining access to care. For beneficiaries, this could mean more denials, more delays, and more appeals. It's something we've never seen before at this scale, and it's something everyone on Medicare should be aware of. Next, let's talk about Medicare Part D, which covers prescription drugs. In 2026, the maximum out-of-pocket cost for Part D has increased by $100. The cap was $2,000 in 2025, and now it's $2,100. On paper, that might not sound like a big deal, but for someone living on a fixed income, an extra $100 can be significant. It's also important to remember that this is a 5% increase, which adds up over time. Prescription drug costs are already one of the biggest expenses for many Medicare beneficiaries. Even with coverage, copays and coinsurance can add up quickly, especially for people managing chronic conditions. Any increase in out-of-pocket costs needs to be taken seriously because it directly affects whether people can afford their medications. Beyond these major changes, there are several other updates included in the list of 11 changes for 2026. Some involve adjustments to plan offerings, changes in how benefits are structured, and updates to enrollment rules. While not every change will affect every beneficiary, the sheer number of people on Medicare means that millions will feel the impact of at least one of these updates. To put things into perspective, about 11,000 people become eligible for Medicare every single day. That's roughly 330,000 people per month and about 4 million people per year. By the end of 2026, the total number of Medicare beneficiaries will likely be well over 70 million. That is an enormous population, and when changes happen, they matter. That's why staying informed is so important. Medicare isn't something you can afford to ignore. A small oversight can lead to big consequences, whether it's higher costs, reduced access to care, or unexpected denials. Taking the time to review your coverage, ask questions, and understand what's changing can make a huge difference in your experience. If you're already on Medicare and you haven't reviewed your plan recently, now is the time to do it. If you're turning 65 this year and enrolling for the first time, it's especially important to get it right from the beginning. And if you qualify for a special enrollment period, don't assume your old plan is still the best option. Circumstances change, and so do plans. I'm here to help you stay informed and prepared. This year is shaping up to be a big one for Medicare, with changes that could affect costs, coverage, and access to care. I'll continue to break down updates, explain what they mean, and help you understand how to navigate the system as smoothly as possible. If you found this information helpful, please consider subscribing so you don't miss future updates. I cover Medicare, Social Security, and other important topics every single day, and my goal is always to give you clear, straightforward information you can actually use. If you have questions, drop them in the comments. I read through them regularly, and they often inspire future videos. Thank you so much for spending your time here today. I truly appreciate every single one of you. Stay informed, take care of yourself, and I'll see you again in the next video.